So Hillary Clinton collapsed and had to be literally thrown into her van by a Secret Service. But it's actually the details that came out after the event that are more bizarre than the event itself. As I mentioned before, Hillary is suffering from a disease called vascular dementia that has a 3 to 5 year life expectancy. The area of her brain affected is called the subcortex. There are some really strange things about the jovial faux Hillary that we saw outside of Chelsea's apartment. First of all, no doctor would ever allow somebody who just collapsed to walk without any help. No doctor would allow somebody who just passed out in approximately 75-degree weather to then go back out in 90-degree midday humidity. A person in Hillary's condition would be ordered on bed rest or minimal activity for a couple of days until the condition could be investigated. Another point, no doctor would ever take Hillary to Chelsea's apartment over a hospital. Also, the Clinton campaign finally admitted that Hillary had pneumonia after saying that she was only overheated at the 9/11 event. Absolutely no doctor on planet Earth would advise somebody with active pneumonia to attend an outdoor event, to shake hands with diplomats, and to cough around politicians. Additionally, no doctor would advise Hillary to go to Chelsea's apartment to be around a postnatal mother and her 2 children. They tried to claim that Hillary was the one who ordered the chauffeur to take her to Chelsea's apartment against the doctor's advice. But as you can see, Hillary is clearly not conscious when she's put into the van. Her knees buckle and her legs go flaccid. She has passed out. So how did all of a sudden she wake up and make a demand like this? It is to say that Hillary's doctor, Lisa Bardak, is either the worst doctor in human history and purposely trying to kill Hillary, or she is completely incompetent. Either way, this doctor has been reckless and inappropriate with the care of Hillary, allowing her to attend events, host fundraisers, and make campaign stops with active pneumonia. It is a myth that bacteria are inactivated within 24 hours of taking an antibiotic, and that it is safe to be around others. I've worked in many hospitals for many years. We place people with certain bacterial infections in something called contact isolation, not just for 24 hours, but sometimes for weeks, depending on what type of infection the patient has. For example, somebody with methicillin-resistant Staphylococcus aureus or vancomycin-resistant enterococci would be placed in isolation for weeks in order to prevent the spread of infection. Lastly, I want to point out that in the United States, there is a protocol in every hospital to vaccinate all individuals over the age of 65 against pneumonia. Hillary had just turned 65 when she was admitted to the hospital in 2012 with a blood clot to her head. This means, without a doubt, that Hillary Clinton would have received a pneumonia vaccine back in 2012. This makes it virtually impossible for Hillary Clinton to have developed pneumonia now, which is why I doubt this whole story is even true. This doctor, Lisa Bardak, was either extremely reckless and should have her medical license taken away, or Hillary does not have pneumonia at all. Again, no doctor in the history of the world would allow somebody with active pneumonia to maintain a schedule like Hillary's and to be around the number of people that she has been around. Hillary Clinton is just simply not a young person anymore, and her previous medical condition in 2012 renders her at high risk for extreme complications with even the smallest of infections. So if Hillary Clinton does not have pneumonia, as I suspect she does not, what in the world went on here? As you can see in the image, she looks like she's having a seizure again. As we explored in the previous video, Hillary Clinton has a seizure disorder and something called vascular dementia. She could have very well have been seizing at the 9/11 event. You'll notice that there is a piece of metal that drops next to Hillary's pant leg. This could have very well been a piece of the auto-injector that was used by the gentleman standing next to her. If the autoinjector was deployed, no doubt that the man who carries it recognized immediately that Hillary Clinton was having an active seizure. This one was much bigger than the one she had in front of the reporters. As I said before, any type of stimuli such as noxious stimuli, loud noises, and a variety of other things can actually stimulate a seizing event in a person. Hillary Clinton at the 9/11 event would have been around thousands of people that were standing next to her to commemorate what happened at the Twin Towers. Hillary has a disease of her brain. Interestingly enough, she is not the only official or person who has worked closely with Obama to have suffered an issue with the brain. If we look at the picture here, we see several individuals who are closely linked to Obama, who have developed brain anomalies, and some of them have died. Starting in the lower corner, Joe Biden has a history of brain aneurysms, yet his condition was almost never discussed by the lamestream media during the 2008 election. His son, Beau Biden, a rising star in the Democratic Party, and somebody who spoke at the 2008 convention for Barack Obama, died of a brain tumor just recently. The next picture up, you see Republican Arlen Specter, who was the 60th vote to pass Obamacare. He suffered from brain cancer and ended up dying of a third bout of cancer in 2012. Obama's Commerce Secretary, John Bryson, crashed his car after suffering a seizure and had to resign. Like his fellow secretary Hillary Clinton, he was also diagnosed with complex partial seizures in 2012. Chief Justice John Roberts, responsible for passing Obamacare in the High Court on 2 occasions, is known to take extended leave of absence due to his condition of epilepsy. Pope Francis received a barrage of attention just last year in the fall after meeting with Obama. It was leaked that Francis was suffering from a benign brain tumor and that he was undergoing secret treatments by a Dr. Fukushima who had flown over from the United States to treat him. Dr. Fukushima is a neurosurgeon who is seen greeting the Pope in public at the Vatican. Jimmy Carter was the only U.S. president to endorse Obama in the 2008 election, until Bill Clinton finally did it at the convention. He also famously claimed that anybody who opposed Obama and Obamacare are racist. Carter, who is commonly listed as one of the worst presidents in U.S. history, was diagnosed with a secondary metastatic brain tumor and is currently under treatment. Harry Reid, the majority leader who was instrumental in passing Obamacare in the Senate, has suffered repeat falls, concussions, and black eyes since 2010. Some sources have speculated that, like Clinton, Reid might actually be in the early stages of dementia. Edward Kennedy was an early supporter of President Obama. It is said that his endorsement resulted in the downfall of Hillary Clinton in 2008. After his endorsement of Obama, Kennedy developed a primary glioblastoma brain tumor, which he would die of. As a part of his endorsement, Kennedy said that Obama had promised to focus on passing a health care bill. Kennedy had to be taken out of Obama's inauguration event because he suffered a seizure. According to sources, Ted Kennedy was the main reason why Obamacare passed the Senate after meeting many obstacles. Ted Kennedy is now dead. Their boss in the middle, however, might be the biggest enigma of them all. Not long ago, it was Barack, who was the source of unusual rumors that something appeared to have gone wrong with his head as well, just like Hillary. The head wound was apparent on photographs, clearly showing that Obama has had an open brain surgery performed while he was in office. I have treated numerous patients who have had surgeries carried out on their heads called craniotomies. Craniotomies are used for a variety of reasons, such as a tumor resection or for cases of trauma. When these surgeries are performed, a cut is made in the bone to allow the brain to swell. Sometimes the bone is removed. This is called a bone flap, which allows the brain to increase in size until the inflammation goes down. This keeps the brain from swelling too large inside the skull, which can push down on the brainstem, causing an irreversible condition called brainstem herniation. When the brain is back to normal size, the bone flap is glued back into place, but sometimes the bone is replaced with titanium plates. Whatever surgical operation was performed on Barack's head does not appear to be isolated. You can see that there are 3 surgical incisions. The largest is a right frontal parietal temporal craniotomy. There is also a large occipital incision and an obvious left temporal incision. His skull appears to have sustained massive trauma, or something else that involves the entirety of his head. The scars indicate that Barack underwent a huge reconstructive surgery at some point while he was in office.
There are people out there, especially in that newfangled think tank that is the blogosphere, who have suddenly become very, very interested in President Obama's hair. Did the president have brain surgery and not tell anyone? Or how is that, and if he did, how has that affected his thinking? Is that why he needs a teleprompter, people have asked online?
The truth will never be revealed to you. If you look toward a deceitful media, we have seen how they have handled Hillary. You must always look past their headlines to understand the real truth. They tell you what to believe to manipulate you into following their agenda.
And from the ashes of their world, we'll build a better one.
Do you not think an angel rides in the whirlwind and directs this storm? This work continues. The story goes on. And an angel still rides in the whirlwind and directs this storm.
When we are successful, and we will be, we have a real chance at this new world order